today we are doing non-surgical treatment for thyroid nodules. That's called microwave ablation. So this is our OT setup. This is the patient, ultrasound machine. That's echo machine. That is microwave machine. Through that machine only we will complete the procedure. So this is our staff. Microwave probe. This is antenna. So through this we will complete the procedure. So these are the adjacent important blood vessels. So while doing ablation to prevent damage to adjacent structures, we are doing one technique called hydrodissection, where the fluid will separate this thyroid gland from the adjacent important structures that you are going to see now. This is how the burning gland will appear. You can see white bubbles there inside the gland. So we are slowly moving the probe from inside to out. Thereby we can complete the ablation. Small tiny incision, we can able to complete the procedure successfully. See, both vocal cords, these two sides are moving, so that means no nerve injury, nothing.